In this video tutorial, we will outline what needs to be done in clinical in order to achieve the menu and clinical quality measures in Stage 2, as well as discuss the changes that were made to the dashboard. So first up are the menu measures. You are required to complete 3 out of the 6 measures available. Keep in mind that while there are exclusions provided for some of these menu measures, you cannot select a measure and claim the exclusion if there are other measures that you could report on instead. What this means is that an EP must meet the measure criteria for 3 objectives. If the EP cannot meet 3, then he or she will need to report on all 6 of the measures during attestation, documenting for each one whether they met the measure or the exclusion. This was a new rule starting in 2014. Most of the measures are completely new for Stage 2. The only exception is the syndromic surveillance measure. Menu measure number 1 is submitting electronic syndromic surveillance data to public health agencies. In Stage 2, you will now be required to submit ongoing data to your public health agency. There are 2 steps that you would need to take in clinical in order to achieve this. First, you would document the CDC status on the diagnosis screen for the applicable diagnoses. Applicable diagnoses would be conditions like AIDS or hepatitis or anything that you may be immunized for. If you need a list of applicable diagnoses, you can reference our user manuals. To modify the CDC status, click Edit Diagnosis, and then select the applicable status from the CDC status dropdown. When you're done, click OK. And OK to close the diagnosis dialog. Then you would produce a batch file of that information to send to your public health agency. And that is done outside of the chart by going to Chart, Export, Public Surveillance Data. From within this dialog, you would simply select your practice, change the date range, select your output file, and click Export. The file will then be saved as an HL7 file. This is not a human-readable type of file, so do not expect to be able to decipher the information if you open it up. Your public health agency can guide you as to where the file should be uploaded if you select to do this measure. As far as we can tell, no states in the tri-state area are set up at the moment to receive electronic syndromic surveillance data from EPs. The only one that is the state of Pennsylvania. However, they require the provider to pay a hefty fee for the service. So we assume most providers will not elect to do this measure. If you're interested in attaining this measure, you should contact your state's health department to find out more information. The first new menu measure that we'll discuss is recording electronic notes in patient records. In order to attain this measure, you must enter and sign at least one electronic progress note for more than 30% of unique patients seen during the reporting period. This is somewhat of an easy measure because in order to meet other meaningful use requirements, you must do so by entering an electronic progress note. The only downfall to this, and it may not even be a downfall for everyone, just depends on your workflow, is that your entire progress note should be in electronic format. What this means is that if you are using our MU template, which is not a complete E&M note, you will need to either dictate or type the rest of your progress note information into that template. Doing part of the note on paper and part in the EMR will no longer suffice. If you are currently using an E&M template that has all the pieces of your progress note, then you are doing exactly what you should be, and nothing has to change. You will only need to change what you are doing if you still document part of your office visit on paper. If you do, you will now need to transcribe what you did on paper into the EMR. Or you could just scrap the paper altogether and do everything in the EMR. Now, there is one new feature in the software related to this measure, and that feature is on the Scan Management dialog. So we'll go to Chart, Scan Documents. On the right, you will see a new checkbox for Scan as a progress note not created in clinical. This checkbox would be used if you do not complete all your progress notes electronically and wanted to accurately document that. Basically, using this checkbox will hurt your statistics for this measure since it is allowing you to document that the progress note you are scanning was not initially created in the software. It may sound strange that we have a feature that hinders your statistics. However, it was required of us as a certified EMR to provide you with the ability to mark a progress note as such, which is why it is here. But let me reiterate it since it's pretty important. Do not use this checkbox if you do not also have an electronic progress note in the chart for that patient, or else you will not receive credit for this measure for that patient encounter. So to recap, for the electronic notes measure, you will need to document your entire progress note in the EMR. We assume most providers will elect to do this menu measure since it's an easy one. The third menu measure is having imaging results accessible through your certified EHR. If you elect to do this measure, you will need to have 10% of all tests with one or more images ordered by your provider accessible in the EMR. In order to attain this, you will need to first document the order through your progress note using a procedure checklist. Then you will need to use the orders tracking functionality to mark the order as completed or reviewed with image. This process of ordering and tracking the procedure is how the software will know how to calculate the number of image tests you've ordered. So let's go through an example of this. First, in order for the software to calculate the statistics properly, you will need to configure all the applicable image procedures as such in the database. And that is done through System Tables. Go to Edit, System Tables, Conditions, Procedures. Search for the image procedure, highlight it when you find it, and click Properties. From within the condition Properties, you'll want to set the type field to Image. You'll also want to make sure that Track Order is turned on. And if you happen to perform this image in your office, then you may want to select In-House as well. The In-House checkbox controls how you review the order. If the order is designated as in-house, the order is reviewed from the face sheet, and an automated chart note is generated once the order is reviewed. If the order is off-site, then it is reviewed from the drop-down at the top of the chart. No auto-generated note is created with off-site orders, since we assume you will probably receive a report from the facility where it was performed. When you're done modifying the configurations, click Save. Then repeat those steps for any other applicable image procedures, and then add them to your template. Then, in order to get credit for ordering the test, you need to select it through a procedure checklist. So open up a chart note and find your test ordered procedure checklist. Click the plus sign next to the image that you'd like to order. From within this dialog, fill out the appropriate information. Now there is one new checkbox in here for initial order created outside of clinical. You will see this option in this dialog as well as the medication dialog, and it will serve the same purpose in both areas. It should be used in a situation where you originally created the order on paper, or maybe over the phone, and then later went into the EMR and added it for proper documentation. If you use this checkbox, you will not receive credit for this order for this measure. We were required to have this functionality for certification purposes. However, we assume it won't be used very often. At this point, the patient has been put into the denominator. You will see a reminder for the order on the patient's face sheet and also on the to-do list under the Orders tab. Then, to receive credit in the numerator, you would need to change the status of the order. That is done inside the patient's chart. So you can either search for them on the left or double-click on the order reminder from your to-do list to open the chart. If the procedure was set up as an off-site order, you will modify the status through the order dropdown at the top of the screen. If this happens to be an in-house procedure, then reviewing the order occurs by right-clicking on the procedure from the face sheet. The mammogram procedure in this database is set up as off-site, so I'm going to review the order status from the drop-downs at the top of the screen. Select the appropriate order from the drop-down, and then select the corresponding status. You do want to make sure that you're selecting a completed or reviewed with image. If you select the plain completed or reviewed, you will not receive credit for this measure. After you've changed the status to either completed or reviewed with image, the patient will now be in the numerator. So to recap, in order to receive credit for the imaging measure, you will need to order your image test through a procedure checklist and then track the status of the order once the result is returned. The measure also requires the image be available through the EMR. This could be achieved through an interface, by scanning the image into the chart, by importing it as an external file, or just by having a link to it from within the chart. Menu measure number 4 is recording patient family health history. This measure requires that more than 20% of all unique patients seen have at least one entry for one or more first-degree relatives as structured data. In our 5.1 release, our family history button changed from a free text dialog to a structured data dialog, and in order to attain this measure, you will need to use this functionality. So let's go into a chart and take a look. I'm going to click Family History, and then you'll see the new dialog. If you entered family history information for this patient prior to upgrading, you will still have that information available. However, it will be labeled as unstructured family history. In order for this information to be in the correct format for meaningful use purposes, you will need to convert this to structured data. To do so, right-click on the item that you want to convert and select Send to New Relationship. Or if you already had the relationship established, you could click Add to Existing Relationship, and then you would see a list of relations to select from. I do not have any existing relationships on this chart yet, so that is why this option is grayed out. Or if you wanted to just get rid of this information and start from scratch, you could select Delete. We'll do the example where we're creating a new relationship, since that is the most common example you guys will run into in the beginning. From within this dialog, the only two fields that are required are the relationship and the disease or lack thereof. When you are converting unstructured data to structured data, you have two steps. First, select the relationship. If you see an asterisk next to the relationship, this indicates that it is a first-degree relative. This is important since the measure states that you need at least one entry for one or more first-degree relatives as structured data in order to receive credit. Then your second step is to select Edit Disease. You will then be taken to a search screen that will have some of the most common diseases displayed for you. You can either find the disease in this list, keeping in mind that if there is a plus sign next to the item, it means it can be expanded to view additional options. Or if you do not see what you're looking for in this list, you can click Search from the bottom of the screen to search the database. Since we see what we are looking for, I'm just going to click Hypertension and then OK. You can then document, if you want, the age of onset. To do so, just click in the box and type the age. If you are converting unstructured data, the original text for this item will always show in the comment field, and you will not have the option to modify it. If that really bothers you, you could always delete this data element by clicking Delete Disease at the bottom, and then add a new disease by clicking Add Disease. At the top of this dialog, you'll have the chance to document additional information about this relative if you prefer to do so. You have the option to document their name, document their age, or if you type in their date of birth, the system will calculate their age for you. If this relative is deceased, you can document their cause of death by clicking Select, and then searching the database for the appropriate cause. Likewise, you could also document their age of death and/or their year of death. The checkbox for no known conditions would be used to document that this relative has no pertinent family history information. You would most likely only use that if you did not have a disease documented at the bottom of the screen. When you are done converting the data, you can click OK. You will then see the information show up under the relationship. Since a single unstructured entry could have included multiple diseases, since the prior functionality allowed you to free text information, the software will not automatically delete the original unstructured family history item. So to do so, you have one last step after converting, and that is just to right-click on the item and select Delete. Then select Yes to confirm. Now let's discuss adding brand new family history information to the chart. To do so, click Add New Relationship. Again, the only information that is required is the relationship and the disease or an indication of no known conditions like we are seeing here. No known conditions will be checked by default whenever you add a new relationship. When you click Add Disease and add something, no known conditions will automatically be deselected. So let's say that this information is related to the patient's father, and maybe his name is Bob, and maybe Bob's birthday is 10/30/1947. So when we hit Tab, we'll see the 66. Maybe Bob has a history of chronic bronchitis, so we'll click Add Disease from the bottom, and we'll search for chronic bronchitis. It's actually found under lung disease, so I'm going to click the plus sign to expand it. Highlight chronic bronchitis and click OK. Maybe Bob also has a history of diabetes, so I'll click Add Disease again and expand diabetes and select the appropriate one and click OK. At this point, you could add comments and/or age of onset. So let's go ahead and do that. Maybe he's had the bronchitis 3 times in the past 5 years. And maybe he was diagnosed with diabetes at age 30. If you're done with this family member and need to add information about a different relation, then you can click Add Another, and it will save you a few clicks. Otherwise, just click OK. If you accidentally clicked OK but really did want to add information about another family member, you can do so from this dialog by clicking Add New Relationship. If you need to modify the information about an existing relation, then you can highlight that relation and then click Edit Relationship Details from the bottom. When you're all done with family history information, click OK. You will then see the new information displayed in your progress note and on the face sheet. So to recap, in order to achieve the menu measure for documenting family history information, you must use the Family History button from within a progress note to enter structured data. If you had entered patient family history information prior to upgrading, you will need to convert the data in order to receive credit. This is a rather easy measure, so we assume most providers will elect to complete this menu measure. Menu measure number 5 is reporting cancer cases to a public health cancer registry. This measure requires ongoing submission of cancer case information to a public health registry. However, this measure will not be an option for our clients, as STI has elected not to partner with any cancer registries at this time. Our dashboard will not display statistics for this measure. However, if you have a way to collect the required data in the appropriate format, then you could still essentially attest to the measure. But in general, please be aware that this will not be an option as one of your 3 menu measures. And lastly, menu measure number 6 is reporting specific cases to specialized registries. In order to attain this measure, your practice must successfully submit ongoing data of specific case information to a specialized registry for the entire reporting period. STI has partnered with the CE City Registry, which sends the data to the American College of Physicians Genesis Registry. From what we can tell, no additional data beyond what you normally enter is required to be documented in the EMR in order to meet this measure. In order to fulfill this measure in clinical, you will perform an automated export of CCDA information for the patients within the date range for the selected provider. The files will be sent automatically to the health portal, and the health portal will pass them along to CE City. This functionality will be available later in 2014, so I cannot show it to you at this time. CE City does charge the provider a fee for this service, which is $399 per provider per year. Now let's discuss the clinical quality measures. You will be required to complete 9 out of the 64 available CQMs. Beginning in 2014, the reporting of clinical quality measures will change for all providers. All providers, regardless of stage or program, will follow the new 2014 criteria. Medicare EPs will have the option to either submit their 90 days of CQM data through the CMS registration and attestation system, or you can submit a full year of data using the QRDA format to receive credit for both the EHR incentive program and the PQRS program. Keep in mind, though, that you will not receive your incentive payment until your CQM data is submitted. Medicaid EPs will submit their CQM data to their state Medicaid agency. Another new requirement for CQM data is that the measures selected must cover at least 3 of the 6 available NQS, or National Quality Strategy, domains. These domains represent the Department of Health and Human Services priorities for healthcare quality improvement. The domains include patient and family engagement, patient safety, care coordination, population and public health, efficient use of healthcare resources, and finally, clinical processes/effectiveness. When you view the list of CQMs, there will be a designation as to which domain the measure is associated with. Now, CMS has come up with a recommended core set of CQMs for both the adult and pediatric population. However, most likely you will not be using those core sets to select your measures, since you must select measures that the ChartMaker clinical program has been certified for, and we have not been certified for all the measures included in both of those core sets. Here is a list of the CQMs that we are certified for. Currently, ChartMaker Clinical is certified for 16 clinical quality measures, and we may be certifying for more by the end of 2014. When selecting your 9 CQMs, you must pick from this list. Keep in mind that you still are allowed to report zeros for your CQMs during attestation, so if you cannot find 9 that are applicable to your practice, that is okay. For providers beyond their first year of meaningful use, CQM data will be submitted electronically in 2014 and beyond. You will be required to submit an electronic file, which will be extracted from our dashboard. However, the exact process of uploading the information has not yet been defined by CMS. For those of you opting to send 90 days of data, you will send your file immediately after attestation. For those of you sending a full year of data to receive credit for both programs, you will submit your CQM data as an electronic file between January 1st and February 28th of 2015. We are not going to demo each CQM in this video. However, I will show you one example. For those of you that reference our user manuals, please be aware that we now have a separate user manual for clinical quality measures. It is available on our website, and I would suggest obtaining a copy for your reference. It will outline exactly what data is needed to attain each CQM. So here is an excerpt from our online manual. We will look at NQF 18 as our example. The first thing that you will see is an overview of the measure and how the numerator and denominator are calculated, as well as the exclusion and domain information. In this measure, you are required to record the percentage of hypertensive patients between the age of 18 and 85 who have an adequately controlled blood pressure. Then, if you scroll down, you will see a required data elements section. This section will outline the information that needs to be documented on the chart in order to get into this measure. So for this example, you'll need an applicable diagnosis for hypertension, a documented blood pressure, and evidence of an encounter. After this section, you will then see a list of the codes that are applicable for each one of those elements. For the documentation of hypertension, for example, you could use an ICD-9, ICD-10, or SNOMED, so we will see a list of all those codes. Please be aware that some data elements may no longer have an applicable ICD-9 code, which means that you may be required to document ICD-10 or SNOMED instead. So please read the manual carefully to make sure that you are using the correct data elements. If the measure has any exclusions, you will see this information listed towards the bottom. The manual will outline the diagnoses or procedures that will get the patient excluded, preceded by a list of the valid codes for each of those data elements. So that was an example of how to use the manual to figure out what needs to be documented for NQF-18. Other CQMs would be deciphered in the same way. Please be aware that the PDF version of this manual will not include a complete list of the codes, but instead each data element will be a link that will take you to this online manual. This was done to keep the paper version more manageable, since the list of valid codes in Stage 2 has increased due to the use of ICD-10 and SNOMED. And lastly, let's talk about the dashboard. To access the dashboard, go to Reports, Meaningful Use Dashboard. The dashboard you will see in 5.1 and higher has been significantly enhanced. It will now allow you to run statistics for Stage 1 or Stage 2, allow you to see your saved configurations, as well as display denominator exclusions and exceptions. To use the dashboard, start by selecting the provider. Then select the stage. Now we are discussing Stage 2 today. However, I do want to point out that there are now two options for Stage 1, 2011 and 2014. Anyone participating in Stage 1 in 2014 and beyond will select Stage 1 2014. The option for Stage 1 2011 is there in case you need to run statistics for a prior year. Then you would select your reporting period. Remember, everybody is doing a 90-day reporting period in 2014. Next, select your measures. Remember, the very first option in the list of measures on the left is to view your unique patient count. This must be higher than 80% in order to attain meaningful use. Please make sure that you're running this statistic on a regular basis to ensure that you are meeting the requirement. If you meet all other meaningful use requirements, but you do not meet the 80% threshold, you will not be able to achieve meaningful use this year. For today's example, let's say that we just want to view the statistics for our core measures. A quick way to do this would be to select the box next to Core All 17 Objectives Are Required, and that will automatically select the measures in the tree view below. If this is the typical way that you will run the dashboard for this provider, then you may want to save this configuration. Saving the configuration will save you time the next time that you need to run statistics for this provider. To save the configuration, click Save As in the upper right-hand corner. Then go ahead and name the configuration. It may be a good idea to use the provider's name and stage to differentiate this configuration, especially if you have several providers in your practice. Then click OK. The next time that you open the dashboard, you will just be able to highlight the saved configuration and click Select instead of manually changing all the fields that we just talked about. Okay, so back to viewing our statistics. So after you select your measures or your saved configuration, then you'll want to click Calculate Results. Please make sure that you are reading this disclaimer. The disclaimer is reminding you that you should have a printed version of the dashboard at the time of attestation. Your results for each measure will then be displayed. Ideally, you want to see the results-based measure showing up in green. A green result means you are achieving that measure. If the measure displays NA in the numerator, denominator, or result column, This is indicating that you will answer yes or no to that measure upon attestation. You will never see statistics show up for these measures on the dashboard. However, please do not assume that there is nothing to be done to achieve these measures. If you have questions on how to attain each one of these NA-type measures, you can reference the user manual for more information. If you have a measure with the result showing in red, this means you are not meeting the requirement. If you would like to troubleshoot to figure out why you aren't meeting the measure, or to see which patients aren't meeting the measure, you can run the reconciliation report. To run the reconciliation report, start by highlighting the measure in question. Then at the bottom of the screen, you will see the options for the report. By default, the report will show you the patients that were not included in the numerator. However, you also have the option to see the patients that were included in the numerator if you think this will help in troubleshooting. After you've selected your configurations, click Generate Reconciliation Report. The report will then display your selected criteria. The report itself has been enhanced to display the note date associated with the patient encounter that got them into this measure. This field was added to aid in the troubleshooting process. So as you can see, the reconciliation report is a great tool to use if you are not meeting the requirements. You'll be able to see which patients are not meeting the requirements and therefore audit their charts to figure out why. Another new feature in the dashboard is the CQM reporting button. This is how you will generate your QRDA report to send your CQM data electronically. To do so, first you would select your CQMs from the list on the left. Remember, you are selecting 9 CQMs to report on in 2014. I'm only selecting one for the purpose of this demo. Then click Calculate Results. After you've calculated your results, then click CQM Reporting. This dialog will explain the difference between the two categories. However, it will be defaulted to Category 3 since this is the format you will use during attestation. So all you have to do here is click OK. Then select where you want the file to be saved. Select somewhere easy for yourself to remember, like the desktop. The file name will default to QRDA, and then the category you selected, the date, and a unique identifier. The file type will be an XML file. Click Save. And then OK when you receive your successful message. The XML file will then be saved to your desktop or wherever you selected to save it. The XML file is the file that you will upload to CMS's website when you submit CQM data during attestation. One last thing I'd like to mention about the dashboard is that some of the core measures now have multiple parts. Examples of this are CPOE, vitals, decision support, view, download, transmit, and the transition of care summary. Please remember that you must achieve all parts of an individual measure in order to meet that measure as a whole. The only exception is for vitals. For vitals, starting in 2014, you now have the option to select which vitals are appropriate to your practice. CMS has given you 3 options, and those 3 options correspond to 4A, B, and C on the dashboard. You will pick the one option to report on for vitals that is most appropriate for your practice, not all 3. However, you do need to fulfill all parts of the other 4 measures I mentioned. Please be aware that you need to be on a version of 5.1 or higher for your entire reporting period before you can attest for meaningful use this year. 5.3 is our current version, and it is currently available through our website. If you have any questions, please contact clinical support.